Hello, everyone. My name is Brendan Neuen. I'm a nephrologist, clinical trialist, and co-chair of the SGLT2 Trialist Consortium, also known as SMART-C. And I'm delighted to be sharing with you today the results of our recent CJASN paper looking at the effects of SGLT2 inhibitors on all-cause hospitalization in patients with chronic kidney disease. Now, as nephrologists, we all know that hospitalizations are a huge issue for our patients. They're disruptive, costly, and often represent a tipping point in the trajectory of CKD. We also know that rates of hospitalization far exceed those for kidney failure or cardiovascular death. But to date, we haven't had a clear understanding of whether SGLT2 inhibitors can reduce this important patient-centered outcome. So to address this, we analyzed data from over 15,000 participants in the three major kidney outcome trials, CREDENCE, DAPA-CKD, and EMPA-KIDNEY. As you all know, these trials were international, multi-center, randomized, double-blind, placebo-controlled trials enrolling patients with kidney disease across the spectrum of kidney function and albuminuria with and without diabetes. What we found was that in the CREDENCE trial, canagliflozin reduced the risk of both first and recurrent hospitalizations compared to placebo by about 15%. And when we pooled these results across all of the three trials, we found clear and consistent reductions in all-cause hospitalization of the same magnitude, about 15% overall. Importantly, these risk reductions were consistent across all subgroup studies defined by diabetes status, whether patients had diabetes or not, and across different levels of kidney function and different levels of albuminuria, including those with little to no albuminuria. We then went on further and looked at cause-specific hospitalizations. What we found were that the reductions weren't driven by one category. They were seen across a broad range of hospitalizations, including infections, cardiovascular events, kidney and urinary disorders, as well as metabolic disturbances. And in terms of implications, because hospitalization rates were so high, even moderate relative risk reductions in the order of 15% translated into meaningful absolute reductions. In other words, we estimated that treatment with SGLT2 inhibitors prevents about 36 unplanned hospitalizations per 1,000 patient years treated. So what does this all mean? Well, again, these data reinforce the role of SGLT2 inhibitors as a foundational therapy for chronic kidney disease. These agents not only reduce kidney disease progression and cardiovascular events, but we've shown in this study that they also reduce all-cause hospitalization, which is an outcome of major importance to patients, providers, and health systems alike. Thanks for listening today, and I encourage you to read the full paper in CJASN for further details.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.